Can you please tell us about the better solutions for healthcare?
With pleasure. Canada is a country that has been very innovative in introducing healthcare for everybody, thanks to Tommy Douglas. It has gone very well for the last number of decades, but now we're facing the issue of how can we support this system as our population ages and the costs are continually rising. So, the CHP platform has several strategies to deal with healthcare. The first strategy is to deal with how can we prevent people going to getting medical attention. And we're looking at ways of improving health through nutrition, through exercise, through family activities that would indeed keep people from becoming obese, eating properly, and having less of the symptoms that come with unhealthy habits of lifestyle that result in needing to go for medical care. Also, we believe that it's very important to establish a small user fee for anybody who goes to an emergency room. I've experienced it myself, where you go to the emergency room and there's a huge lot of people, and most of them there are there for very mundane or unnecessary things. A small user fee would eliminate that. It would reduce wait times at most hospitals in our country. We need to continue as a federal government to provide transfer payments to the province to help with covering the cost of health care. I know when the previous Liberal government was in power, they reduced it substantially, and then they made a process of increasing it 6% per year as transfer payments to the provinces. We would support that, and we would say we should keep this at a 25% level of our total funding going to healthcare across the country. We would also encourage a one-payer system where the government pays the money, but have multiple private delivery systems. Where this would create competition, and this would encourage for more efficiency, probably for a substantially lower cost, and would be a win-win situation for everybody. Quicker service, more service, lower cost. The other issue we would address is the whole issue of rural doctors. Here in Simcoe Grey, for example, we are having an issue of many people not having a family doctor. And we believe that rural doctors are important and necessary. So we would do the same as what is done in the military. We would provide free education for all doctors who would choose and be willing to go to a rural setting and put in 4 years of service or more. And we would do this in a way that would really encourage the doctors to stay in those rural settings as well. In Canada, with the CHP, Canada would also provide to the Bank of Canada funding to improve rural hospitals and infrastructure that would make the facilities more up to date and make it more attractive for these kind of doctors who once go to a rural setting to want to stay and continue to serve in those rural settings. So that in a nutshell is what our strategy would be. We would continue with the single payer system, but we would change the way we would do business, and we would do a heavy focus on preventative medicine. Thank you.
Thank you.